Hello everyone. In this video, we will be learning about the basics of Trendelenburg sign. Trendelenburg sign is the result of defect in the abductor mechanism at the hip, which consists of three components: power, fulcrum, and lever. Power is provided by hip abductors. These are gluteus medius and minimus. Fulcrum is the hip joint and the lever is the head and neck of femur. The defect can arise from any of these three. Let's learn about the power component. The attachment of gluteus medius and gluteus minimus is from outer surface of ilium to the greater trochanter of femur. Both of these muscles acting from pelvis, that is when the pelvis is stationary and the femur is moving, they abduct the thigh like this. So these two muscles are the powerful abductors of the thigh. Acting from femur, that is when the thigh is stationary, they play an essential role in maintaining the trunk upright when the foot of the opposite side is raised from the ground in walking and running. In this phase, the body weight tends to make the pelvis sag downward on the unsupported side, and this is counteracted by the gluteus medius and minimus of the supporting side, which, acting from below as the thigh is stationary, exerts such a powerful traction on the hip bone that the pelvis is actually raised a little on the unsupported side. When there is defective abductor mechanism, that is defect in either power or fulcrum or lever. For example, defect in power can be paralysis of gluteus medius minimus muscle or injury to the superior gluteal nerve. Defect in fulcrum can be congenital or pathological dislocation of hip. Defect in lever can be the defect in head or neck of femur. There can be fracture neck of femur, etc. In any of these conditions, when the person stands on the affected side, pelvis on the unsupported or normal side will drop downwards. This sagging down of pelvis on the unsupported side is called as positive Trendelenburg sign. And the characteristic gait in such patients is called as lurching gait, where while walking the trunk tilts to the affected side. Trunk tilts to the affected side. And if this defect is bilateral, it is called as waddling gait. So to summarize, in normal conditions, pelvis on the unsupported side will be raised, whereas in positive Trendelenburg sign, pelvis on the unsupported side drops downward. There is sagging down of pelvis on the unsupported side, is called as positive Trendelenburg sign. Thank you.